Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today we're talking about stem cell therapy for kidney disease. This is a kidney. It's not a real kidney. It's actually stuffy. That would be gross, right? I brought a real one in. This one is frowning because it has kidney disease. We don't want that. We want it to be smiling, right? So how do we go from here to here? Well, I'm going to tell you. So kidney disease in India is rampant, just like it is in the United States, the rest of Asia. Why? Well, the number one reason that people get kidney disease is from diabetes. And when you don't control diabetes well good enough, then one of the main side effects is kidney disease. Now, high blood pressure is a second reason. So if you have diabetes and high blood pressure, that's like the double whammy. And oh, by the way, maybe it's with a smoker as well. So boom, 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 kidney disease. End up with a big time frown. Now, what happens with kidney disease? Well, when you look at the main factors, one of them is called the Glomerular filtration rate, GFR. When I look at that, normal would be around 90, 95. When we start seeing it go down, 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 that becomes a problem. Why? Well, there's a lot of duplicative function in the kidney, which is great. You could have half your kidney functioning and just be fine. Like you wouldn't even know. You wouldn't have any symptoms. Your kidney's getting the job done. But once you start to get down to a certain point, then it becomes a big problem because you start to get a lot of symptoms, lack of energy, big time aches and pains. You're not peeing well, and these toxins are building up in your body. All right, so your doctor's going to start recommending you get on dialysis. Dialysis is fun, right? 3 times a week, 2 or 3 times, maybe 4 times a week, 4 hours sitting in a dialysis center, hooked up, to the machine. That is not the best way to live, not the great way to use your time. How do we prevent this? All right, stem cell therapy has been a very, very good treatment option for kidney disease. Now, if you're getting down to glomerular filtration rate in the 40s, 30s, 20s, we can help you tremendously. It's a very straightforward treatment. We do stem cell therapy IV. Stem cells will circulate through your body, and they will go to wherever there's inflammation. That was shown in a Harvard study about 20 years ago. All right? Stem cells and exosomes that we use circulate through the bloodstream. They seek out inflammation. They will deposit themselves there. And when you have kidney disease, there's a lot of inflammation in the kidney. So the stem cells will deposit themselves in the kidney. They will work to amplify the function of the kidney by repairing and restoring the cells that are necessary to do that. Okay? So we've taken many patients from stage 4 kidney failure to stage 3, even stage 5 to stage 4. We recently published this paper that I'm pointing to with a case report of a patient we treated who had a GFR of only 11 when we treated him, and we bumped it up to over 25 within about 4 weeks, maybe 6 weeks. And then over the period of 4 months, we were able to follow him, and his GFR stayed over 20 for the duration. His creatinine came down from over 5 to the mid-3s. That's where it finished up after the 4 months. So the patient was ecstatic. He'd been told there was nothing else his nephrologist could do for him. He needed dialysis. He said, you know what, let me try this procedure first. And with the outcome that he got, he called it regenerative dialysis. And I love that term. So what are the outcomes for someone like our case report patient? Well, he did great for 4 months. His results were here and slowly decreasing. So he ended up needing a repeat procedure at the 6th 6-month point. And he'll probably need a few of those treatments every 6 months, and then maybe start to space it out after that. Would you rather get a treatment every 4 to 6 months or be on dialysis 3 to 4 times a week, right? It's going to inhibit your potential to travel, to enjoy time with your friends and loved ones, all right? This is a better option. Now, when I talk about the stem cells circulating through the body and they'll go to the kidney because it has inflammation, they will also go to other areas that have inflammation. If you're dealing with diabetes, they'll go to the pancreas, but they'll also go to the heart. They'll go to, say, if you have neuropathy in the legs, they'll go to those nerves, and they will help reduce that inflammation and amplify the repair and regeneration. So it's not just kidney disease we're talking about. So with stem cell therapy, we can take a very unhappy kidney and turn it into a happy camper. Call us today at the number on the screen for a free consultation. Also, please go to our website at r3stemcell.com/India and download this consumer guide that I wrote that goes through a lot of the studies that are available for showcasing some of the beneficial results with stem cell therapy. Same results that we get, right? So call us for that free consultation. We'd be happy to help you.